Good afternoon, everyone, and welcome to the Booker T. Washington Awards Luncheon. My name is Virgil Miller. I'm a Senior Policy Advisor at AkinGump. Health Policy Advisor by background. I spent 13 years in the U.S. House of Representatives, and most importantly, I'm a National Minority Quality Forum 40 Under 40 awardee. I have the pleasure and honor of serving as your Master of Ceremony for this awards luncheon, and I welcome each of you. I trust everyone has had a great experience with the virtual summit thus far. We thank the entire NMQF team for their flexibility and their commitment to ensuring each of us has access to the great programming the summit is known for in a virtual environment. The Booker T. Washington Award recognizes an individual or organization that has made an outstanding contribution to the promotion of wellness in emerging populations. Booker T. Washington started the National Negro Health Week in 1915 to promote wellness in Black Americans. From 1921 to 1953, National Negro Health Week was a program supported by the U.S. Public Health Service. By partnering with Congress and the White House, 45 years later, NMQF started National Minority Health Month in 1998 as a successor to National Negro Health Week. It is in honor of the vision of Booker T. Washington and in celebration of National Negro Health Week and Month that we gather this afternoon. It is my honor to introduce someone who is not a stranger to any of us. He is the founder, president, and CEO of the National Minority Quality Forum, our fearless leader who has been on the front lines of minority health for decades, Dr. Gary Puckrein.
Virgil, thank you so much for that kind introduction. And we are so proud of you and all of our 40 under 40. What an amazing group of individuals who are going to be leading healthcare in the United States for the future. So we're very excited to have you part and some of the other 40 under 40 members. It is my great duty and responsibility to begin by thanking our sponsors for the support that they've given the National Minority Quality Forum and to this summit. Regrettably, we were unable to do our summit in April, and I miss so much being with each and every one of you. I enjoy that summit so much every year, but I've been pleased by the turnout for the virtual summit. There's been marvelous panels, lots of great information that's being shared, and all of it really because of the commitment made by our sponsors. I'm pleased to announce that our title sponsor for the 40 under 40 program is Amazon. I've just been amazed at the individuals in the 40 under 40 program. We launched that program in 2016. And each year we've identified 40 young people who are really making tremendous headway and making a tremendous contribution to American healthcare. We now have over 200 40 under 40, and they're connected. They're not just working with us, but they're working with each other, and they're making a tremendous difference in American healthcare. Our platinum sponsors this year are Baxter Healthcare, Biogen, the Centene Corporation, Global Blood Therapeutics, Pharma, and Regeneron. The gold sponsors are Genentech, Novartis, Sanofi Pasteur, and Merck. Our silver sponsors are CVS Health, Eli Lilly, GlaxoSmithKline, the Lupus Research Alliance, Medtronic, Novo Nordisk. Really, I can't say enough, but thank you so much for your support and your confidence, and what everyone should know, that all of these companies are on the front line, making a tremendous difference in the effort to eliminate health disparities and we're so pleased for their support. I'm going to turn the program back over to Virgil.
Thanks so much, Dr. Puckrein, and we thank and acknowledge all of our sponsors for the summit. I am now going to turn it over to someone who has been a tremendous supporter of the summit and the National Minority Quality Forum, and that is Dr. Susan Bailey. Dr. Bailey is currently the president of the American Medical Association. She was elected president of the AMA in June of this year. Dr. Bailey is an allergist and immunologist by trade, and she hails from Fort Worth, Texas. Previously, Dr. Bailey served as president-elect of the AMA for 1 year, speaker of the AMA House of Delegates for 4 years, and is vice speaker for 4 years. So without further ado, I'm going to turn it over to Dr. Bailey.
Thank you so much, Virgil, for that kind introduction. It's really an honor and a pleasure to be a part of this year's National Leadership Summit. The AMA is so proud to partner with the NMQF. Now, I don't have enough time to talk about all the ways the AMA has supported physicians in this most difficult year, from training and resources to help in the COVID response effort, to financial support to keep struggling independent practices afloat. The AMA has been the physician's most trusted ally from the beginning of this pandemic. But I want to take a moment to acknowledge the amazing work of not only physicians, but of nurses, of caregivers all over the country who so heroically have risen to the challenge of this extraordinary moment. Some in our community have died from COVID-19. Many have fallen ill. All have worked very long hours under intense pressure and sometimes dangerous conditions. We still have a lot of work ahead of us in the fight against COVID-19, but I want to offer my most sincere and heartfelt thank you for all that you've done and for all that you will continue to do to limit the spread of this virus. There are so many layers to this pandemic and so many tragic stories. Some of the most devastating, which I'm thankful has received some attention, is the disproportionate impact of COVID-19 on Black, Latino, and Native American communities. Now, as we all know, and as I touched on my opening remarks this morning, there are long-standing and systemic inequities within healthcare and throughout society that shape and influence a person's prospects for a long and healthy life. Now, these determinants of health, which correspond to a person's ability to access the care they need, housing, employment, education opportunities, just to name a few, these are some of the underlying factors that are driving so much suffering and death in Black and Latino communities in this pandemic. They're also a major factor in disproportionately high rates of chronic illness. Chronic disease, obesity in these communities, which lead to poor outcomes and generally shorter lifespans. 2 years ago, our AMA House of Delegates adopted a new policy designed to achieve greater equity in healthcare that laid the groundwork for the creation of our AMA Center for Health Equity. The goals of the center are to promote equity in care, to advocate for healthcare access, research, to increase health workforce diversity, as well as cultural awareness and competency, to influence the determinants of health, and to join other leading national voices in medicine, like NMQF, in speaking out about the persistent inequities in our system and in working in collaboration to fix them. One area of collaboration between NMQF and the AMA this year has been a series of very informative and engaging virtual discussions around improving minority health in the era of COVID. That series can be found on YouTube if you search National Minority Quality Forum. Similarly, the AMA has had our own Prioritizing Equity video series, which is led by our Center on Health Equity, that can be found on our website and highlights some of the areas of partnership and shared goals between our partner organizations. At the AMA's virtual meeting of the House of Delegates last June, Our leadership pledged to take action on racism in health and society. Specifically, we reiterated our position that racism is an urgent threat to public health, the advancement of health equity, and a barrier to excellence in the delivery of medical care. That we oppose all forms of racism and denounce police brutality and all forms of racially motivated violence, and that will actively work to dismantle racist and discriminatory policies across all of healthcare. The AMA Center for Health Equity and our Minority Affairs section, some of whom have been invited to present during sessions of this summit, are the leading voices on this work. We've reached a critical stage in this pandemic, and everyone's eagerly awaiting the arrival of a vaccine. There are a number of promising trials underway to determine the safety and efficacy of experimental vaccines. And it's critical that we have diverse representation participating in these trials so that we have a complete understanding of how various vaccines respond to people from all backgrounds, races, and ethnicities. It's crucial that drug makers prioritize the best ways to make inroads into communities that they've historically ignored for vaccine trials, so that we have a complete understanding of a new drug's risks as well as any unforeseen benefits. There are communities where there is, rightly, a lot of mistrust after decades and decades of mistreatment, exploitation, and injustice. Historically, African Americans make up only about 5% of clinical trial participants. Hispanics even less. So we need to go much further than this as a medical community. We must do all we can to answer questions and allay concerns for groups that pay a heavy price for being left out of clinical research that helps in the fight against deadly viruses and diseases. So I thank you again for the opportunity to be a part of this summit to highlight some of the ways the AMA is working toward greater equity in medicine. I look forward to continued conversation and continued partnership with NMQF to create a more equitable healthcare future for everyone. Thank you and congratulations to our award winners.
Thank you so much, Dr. Bailey. Our first award, it actually started in a trip that we took to Minneapolis last February, just before the virus. Didn't know at the time that that was going to be one of our last trips before we all had to hide in place, I call it, from the virus. It was a meeting at a company called Medtronic. And we went to the meeting to talk about cardiovascular disease. Obviously, the issue of cardiovascular health in the African American community is concerning. And we were looking to partner and understand ways in which we can improve health outcomes for minorities with cardiovascular disease. And as one does at this meeting, we began to introduce ourselves. And the folks at Medtronic introduced us to their African Diaspora Network. Now, Medtronic is a large employer, has over 100,000 employees in 150 countries, worldwide. And they launched this program, a corporate program, to hire, retain, and promote minorities in their company under this program called the African Descent Network. It is an amazing program. In our travels, we talk a lot to companies that are thinking about and working on ways to improve their number of minorities in their workforce. But here we saw an example that was really working. Medtronic, I think, had created a program that is a model for others to emulate. They are aggressively recruiting and engaging and developing talented minorities across Medtronic. So they're not just bringing them in, they're making sure that they find pathways forward that will lead to successful careers and promotions inside Medtronic in areas from sales to engineering. All along the way, they've made tremendous progress. And we thought that this program was one that we should bring attention to, one, to acknowledge really the tremendous work and success that they've had in strengthening their cultural programs and also increasing the diversity of their workforce, and also to show an example to others how to go about the systematic way of creating diversity inside a corporation. So it's with great pleasure today that I have the opportunity to introduce Nnamdi Njoku, who is the Vice President and General Manager of the Mechanical Circulation Systems Business Unit and Chair of that African Descent Network. Njoku, please.
Thank you, Dr. Puckrein. Thank you for having me, and thank you for honoring Medtronic with this outstanding Corporate Citizen Award. Jeff Martha, our CEO, was looking forward to being here. This is such a great honor, so please accept his regrets for not being able to join us. I thought I would keep my remarks brief and really focused on who we are as a company, what we believe in, and what part we're playing to eliminate health disparities in our communities. You see, at Medtronic, creating an inclusive, diverse, and equitable culture is ingrained in everything we do. It's a part of the Medtronic mission that was written over 60 years ago. And we're grateful at Medtronic for that mission because it guides all 90,000 employees with regards to the decisions that we make every day. It's a mission that calls for us to direct our growth in areas of biomedical engineering. It's a mission that calls for us to alleviate pain, restore health, and extend life. And it's a mission that calls us to recognize the personal worth of all employees for who they are and what they contribute. We believe that diversity of thought helps us become better partners in delivering healthcare. When we include diverse perspectives, we make better decisions, we create more innovative products and therapies, and we represent our global customer and patient base. You know, it's important right now more than ever that as companies, we get out of our comfort zone and we stand up for what's right, and we stand up for our employees and our communities. Medtronic is doing this in different ways, but I know that there's more we still need to do. We're working hard to support our employees, their unique backgrounds, their experiences, and their roles. And several years ago, we created employee resource groups that you just heard about. Today, we have 7 of those groups: the African Descent Network, the Hispanic and Latino Network, the Medtronic Women's Network, our Pride Network. Our goal really with these networks is to drive equitable opportunities for all demographics and to provide a support system for employees in their workplace. We've also set aggressive hiring goals internally to drive hiring, recruiting, and retaining diverse talent. We all know that employing a diverse workforce improves our opportunity to drive down disparities of care and to deliver more innovative therapies in the marketplace. From a business perspective, there are several initiatives we're driving to improve care. Back in 1970, our founder, Earl Bakken, demonstrated this commitment by being a good partner. At that time, we were the first corporate sponsors of the Association of Black Cardiologists. And to this day, we're still partnering with that organization because our missions are aligned and we're focused on providing equitable care to all patients. As an industry leader, we believe we have the obligation to do our part to identify and execute strategies to drive down disparities of care and improve clinical outcomes. But we also recognize that 80% of a person's health is impacted by social determinants of health. Because of this fact, we've increased our investments in organizations that focus on improvements in areas such as education, transportation, and access to healthy foods. Specifically related to education, we've recently given to the Thurgood Marshall Scholarship Fund to create a partnership where we'll be hosting professional development sessions for their cohort of students. And this is really about investing in historically Black colleges and the talent that comes from those schools. And over the course of the years going forward, we'll be providing summer internships for a large cohort of students that come from historically Black colleges. In Minnesota, where the US headquarters is based, we rank 50th out of 50 in the nation for our educational achievement gap by race. Medtronic, as a result of this, Medtronic has formalized a partnership with the Northside Achievement Zone to help focus on permanently closing the achievement gap and ending generational poverty in North Minneapolis. Finally, we've also developed a program which is designed to help people who are incarcerated get access to good paying jobs in manufacturing. So when you look at all these issues of racial injustice that we face in the world, it's easy to get overwhelmed. However, I and the more than 90,000 employees at Medtronic are committed to doing our part to make this world better for our providers who use our technologies, for our patients whom we serve, and the communities where we reside. So on behalf of all 90,000 employees at Medtronic, I thank you for honoring Medtronic with this award. Thank you very much.
Njoku, thank you so much. And we're so pleased to be able to make this award to you and to the many attendees and some of our corporate folks on listening in. I would suggest to you that you might want to reach out to Njoku because building workforce is really about structure. And I think you'll find great information and a great model that you might want to emulate.
Thank you.
So our next award is this really started out at one of our summits several years ago. Darrell Green approached us and wanted to talk about some of the work that he was doing in community. So I'm a football wannabe, played football in college, but never got to the level that certainly Darrell got to. But, you know, I'm absolutely starstruck and was really pleased to learn about the program that he's doing, because I fundamentally believe athletes for guys like me and when I was young, they are really role models and they can do so much in our community, particularly with our young people, because being a good athlete is about being hard, it's about hard work. You may have talent, but you got to develop that talent to be competitive. And so if you can be competitive on the field, you can be competitive in the classroom, you can be competitive in the workforce. And so I always thought that athletes had so much to give and learn from. And so Darrell Green, he's putting that to work. And out of that conversation and presentation that Darrell gave, we got linked up with the Pro Football Hall of Fame. And you're talking about an organization that started in 1964, so it's over 60 years old. It's a nonprofit education organization, and by its mission to honor the heroes of the game, preserve its history, promote its value, and celebrate excellence everywhere. They have a tremendous voice that young people listen to, and there's so much that needs to be done. I was in a point of privilege. I was in St. Louis when Darrell Green and a number of the other Hall of Famers were presenting to high school and some junior high school children. These would be minority children in St. Louis. And I'll never forget the question. So it's an auditorium. The auditorium is full. And Darrell Green asked the children in the audience, to stand up if they had been impacted by gun violence. The whole room stood up. All of the kids in the room stood up. It said to me, my God, what have we done to our children? We need to reach out. We have to work with them. And Darrell Green and these Hall of Famers were telling the children their experiences, but also saying to them that there's a way forward, that you can really strive and make an important contribution. So super pleased to be able to introduce to you the president of the Hall of Fame, David Baker, and the class of 2008, Darrell Green.
The Pro Football Hall of Fame is proud of its strategic partnership with Centene Corporation. Under the Strong Youth, Strong Communities initiative, our teams are reaching middle and high school youth across the nation, delivering strong messages about mental health, wellness, and leadership development. With a core team of Hall of Famers, Aeneas Williams, Darrell Green, and Anthony Munoz, and special Hall of Fame ambassador and former women's basketball star Iman McFarland, the group has also been joined by other Gold Jackets, Derek Brooks, Steve Largent, Isaac Bruce, Randy Moss, and legendary coach Tony Dungy. Strong Youth, Strong Community Summits have been held in 19 communities in front of live and virtual audiences in the hundreds of thousands. The impact of and influence was evident.
One thing I've learned today is opportunities, and I've had many opportunities over the course of my life. Some that I haven't taken, and some that have benefited me in ways that I can't possibly imagine. And opportunities will come and go. You just know when to take them. And if you take those opportunities, the opportunities that are the right ones, you'll go far in life.
The Hall of Fame's commitment to building stronger and healthier communities also includes supporting the national No Child Eats Alone anti-bullying school initiative, creating Hall of Fame PSAs during the COVID-19 epidemic for communities of color and the underserved, bringing Hall of Fame Gold Jackets behind prison walls to discuss important health issues, mental health and wellness, and partnering with the National Minority Quality Forum and the Congressional Tri-Caucus to support community health fairs and health screenings in minority and medically challenged areas of the country. Given the challenges associated with large gatherings during COVID-19, the Hall of Fame and Centene recently held 2 virtual town halls with Ohio's Governor Mike DeWine and youth across the state of Ohio, as well as the New Hampshire's Governor Chris Sununu and youth in his state of New Hampshire. The recent summits focused on critical issues such as the challenges associated with COVID-19 and suicide awareness and prevention. The Pro Football Hall of Fame is committed to continuing our mission of engagement of health and wellness issues. We want to empower and inspire the next generation to be the best they can be through health and wellness.
So we'd like to present this award to the Pro Football Hall of Fame.
Brandon, thank you very much. Thank you all. At the Pro Football Hall of Fame, we're fortunate to have the Lombardi Trophy that's presented at the Super Bowl a year before, and we display it proudly, as we will this Booker T. Washington Award. And I want to thank the National Minority Quality Forum for recognizing these efforts on behalf of us and our partners. These are difficult times. These are dark times. We've got a worldwide pandemic. We've got an economic crisis. We've got people crying out for social justice and police reform. We've got hurricanes devastating our communities and wildfires devastating our forest. And through it all, there are good people there. Another one of my Hall of Famers, Coach Tony Dungy, often sends me a verse. And the verse he sends me during these dark times is Romans 12:21. Do not be overcome by evil, but overcome evil by doing good. And the Pro Football Hall of Fame has been very proud to huddle up with the Centene Corporation to do good. You know, huddling up in our business is very important. You take away all the noise and you get shoulder to shoulder, you get heart to heart and head to head, and you come together and you get on the same page and you commit to each other that we're going to do something about that adversity on the other side. In some respects, it's the truest manifestation of Martin Luther King's dream that his 4 children would be judged not by the color of their skin, but by the content of their character. You see, in our business, we measure character by the yard. Whether you're on offense and trying to get that yard, or whether you're on defense like Darrell Green and trying to keep them from getting that yard. But in life, we're all trying to make progress together. And the Centene Corporation has been a wonderful partner of ours in doing this. They've been a great teammate that has huddled up with us to make progress together. And I'm here with John Dinesman, who is the Executive Vice President of Centene, and his partners, Carl Garrett and the incredible Joyce Larkin, and of course, CEO Michael Nydorf. These guys are making a difference. They are a Hall of Fame company making a difference in the communities they serve. They are going into the forgotten, as you saw in that video, in prisons and taking care of them and their families and the people who work there. They're going into the inner cities where sometimes there's no hope and only despair, and coming in and making a difference. They're dropping in our Hall of Famers into those situations, like Darrell Green, who brought this program to us, who can make an incredible difference. Because while we think they fell out of bed great, and this one probably did, he just ran a 4.540 at the age of 60 years old on his birthday. But every one of them, including Darrell, every one of them that I've come to know, had to overcome great adversity to be great. And we think it's because of their speed, or because of their size, or because of their strength. As I've come to know them, I can tell you it's because of their heart. And they can take that heart into communities and give hope, to give restoration and redemption, and say, hey, we're going to make this together. And the Centene Corporation has just been a wonderful partner. They are overcoming evil by doing good again and again and again. The Strong Youth, Strong Communities is that kind of program, where they'll drop our Hall of Famers in there, and they love doing this, by the way. They love making a difference. And they will go in with that gold jacket, and they'll talk about teen suicide. They'll talk about bullying. They'll talk about peer pressure. They'll talk about leadership development, and they will inspire change. We're excited to be a part of this. We're excited to be a part of the Booker T. Washington Award. He was all about education and about enlightenment, about making a difference. And we would invite you into our huddle, both the Centene Corporation, our gold jackets, and there's only 174 living like this today. There's 326 who have a bronze bust at the Hall of Fame. But what made them great might not make you a great Hall of Fame football player, but it could make you a great dad, or a great mom, or a great researcher, or a great business person. It can certainly make us a better family, stronger companies, closer communities. And I believe that these values that beat in this heart can make us a great nation. And wouldn't it be a wonderful dream if we help the next generation to be more loving, less judging, to be more compassionate, to have more courage, to be healthier than ever before. So this is the purpose of Darrell Green and our 174 living Hall of Famers, and our partner, the Centene Corporation. We could not be more proud to be playing against an incredible adversary. As dark as it gets, it is in the darkness that the light shines the brightest. And we think that this can be, by joining together, by huddling up, we think that this can not only be a candlelight in the darkness, we think it could be a beacon of hope for a future generation that's going to be better than ever before. So I want to thank Centene very, very much for the quality that you do. I want to thank Darrell and all of our Hall of Famers. I'll tell you, it's not just about the worship of the football hero, but again, inside this heart beats a great and godly man. And that's true of so many of our gold jackets. And they not only made a difference on the field, they want to now make a difference in the world. So come join our huddle. I want to thank, on behalf of our board of directors, all of our gold jackets, our staff, and the incredible George Veras and his team that produces these efforts wherever we go. I want to thank you for the Booker T. Washington Award. And I want to promise you that we're going to display it prominently at the Pro Football Hall of Fame in Canton, Ohio, the most inspiring place on earth. And we are committed to making a difference, not just today, but every day until we get to where we want to go. Thank you.
Awesome. Well said, and congratulations again to each of you. That ends our awards luncheon. I thank everyone for joining us this afternoon, to Dr. Bailey and all of our colleagues at the AMA. We thank you for your support of the summit, but more importantly, we thank you for the courage and leadership your membership is displaying on the front lines each and every day. We acknowledge and continue to honor the work of Medtronic and the Pro Football Hall of Fame. We thank everyone who's joined us this afternoon to recognize both Medtronic and the Pro Football Hall of Fame. They are bright lights in what has been a challenging year. We're convinced they're not doing the work for attribution, but they are doing the work to make a difference and to improve lives. We honor them for that work. We honor them for the work that they're doing, and we honor them for the work that is honoring the vision of Booker T. Washington. It has been an honor to serve as your Master of Ceremonies this afternoon. We hope you enjoy the remaining sessions of the summit, and there will be a link to the next program in the chat box. We wish each of you well in a great summit. Thanks all.